According to Teresa Sullivan Barker's AARP article in 2023, ADHD in older adults diagnosis and treatment, 75 to 100% of adults who are found to have ADHD were never diagnosed as children. Mental health issues and existing stigma surrounding mental health continue to rise in growth as a public health concern. It is important to find means to improve everyone's quality of life. However, marginalized and medically underserved populations may not get the same opportunity and privilege to do so. Our program strives to spread awareness of the importance of ADHD screening and advocate for late diagnosed ADHD among middle-aged women. Our program's goal is to empower middle-aged women who may not get the same opportunities or may understand the health risks that come with being indifferent on prioritizing one's mental health or having distrust in the healthcare system. Dr. Stefan Ferrone states, adults who have received an ADHD diagnosis experience improved functioning, better health-related quality of life, and stronger self-esteem compared to adults with ADHD symptoms but have no diagnosis. By partnering with organizations such as Children and Adults with Attention Deficit Hyperactivity Disorder, CHADD, and the ADHD Center for Success, San Diego, we hope to give back to our community and empower women to take control of their health safely and effectively.
Our primary goal is to improve the overall well-being, quality of life, reduce stigma, raise awareness, and advocate for medically underserved women aged 40 to 60 years old in San Diego who may be diagnosed or diagnosed late with ADHD. Our SMART objective is we want to generate more survey responses from women aged 40 to 60. We will track this with the number of total survey responses with the written survey from our assessment questionnaire. This will give our survey participants the opportunity to see if they are aware of what's ADHD, if they understand the risk of ADHD, and if they may have undiagnosed ADHD. We will monitor this during our next survey by spring 2024. We would also use the data collected from our survey and data from our collaborators like CHADD to help inform the future staff working at the center. Ideally, we would want to build the center using funding from the government through grant proposals, and we would like to be located in an area that's highly dense with our target population. Depending on our approval time, we aim to open the center at the end of 2024 at the latest.
The Empowering Women program is designed to help medically underserved women between the ages of 40 to 60 in San Diego who are undiagnosed or have been late diagnosed with ADHD. Empowering Women program will focus on raising awareness, reducing stigma, providing accessible services, and attainable medical advice from qualified staff. It will be implemented in San Diego, focusing on targeting medically underserved areas where low-income women reside. Various locations will have accessibility to the following to better target our population, such as community workshops, access to mental health professionals, resources for skill development, and screening. The Empowering Women program will happen by giving surveys to gain insight on how many women may be living with ADHD. Various communities will be monitored to target those with a larger percentage of those who lack mental health resources. Funding will be sought through the government and sponsorships to help open an on-site ADHD mental wellness center, and mental health professionals and certified staff will be hired to help run the wellness center, providing resources, support groups, medical advice, and ADHD awareness. The Empowering Women program timeline will begin in November 2023 with the initiation of the program. From November to April 2024, the program will reach out to receive government funding and sponsorships with CHADD. Data will be collected on ADHD awareness and how to overcome limitations. By April 2024, collection of the data on ADHD awareness and available resources in communities should be completed, and government funding and aid from CHADD should have been achieved. From May to November 2024, finalizing the location in where the ADHD Mental Wellness Center will be opened will be looked at. Hiring certified staff and mental health professionals and spread of awareness of Empowering Women program and what it will bring to the community will be the focus. By December 2024, the Empowering Women program shall begin taking place through the new on-site ADHD Mental Wellness Center. Continuing on from 2025, there shall be a continuous improvement to the Empowering Women program and lowering the percentage of women with undiagnosed or late diagnosed with ADHD.
The program will collaborate with prominent community partners such as CHAD, Children and Adults with Attention Deficit Hyperactivity Disorder, and the ADHD Center for Success San Diego. These partnerships will provide invaluable resources and expertise in the field of ADHD. The program will be led by a dedicated team consisting of directors and managers who will oversee the implementation and ensure the program's objectives are met. A staff of psychiatrists and therapists will provide professional medical support, while health educators and nurses will offer educational resources and personal wellness strategies. Analysts will evaluate program data to inform ongoing improvements. On the ground, program staffing will include leads who will guide various aspects of the program and receptionists who will serve as the first point of contact for the participants. Support staffing will further include outreach workers responsible for engaging the community, interns gaining practical experience in the field, and volunteers contributing their time to support the cause.
These are our potential concerns and limitations. Finding willing participants to survey and interview in the preparation of our wellness center. Finding sufficient funding through government grants and donations. Finding a suitable and accessible location in San Diego that is dense with our target population. Finding a way to spread awareness about the newly made wellness center to our niche demographic. Getting our target population to have trust in health organizations may also prove to be difficult. While similar, more reputable organizations like CHAD may exist, our program and wellness center aims to specifically cater to our target audience in San Diego, as opposed to CHAD, which has a wider spread throughout the United States.
With our proposed program, we will address problems regarding socioeconomic gaps in access to mental health facilities and resources among medically underserved middle-aged women between the ages of 40 to 60 years old. It is prevalent among marginalized populations that there is a distrust in the healthcare system, stigma surrounding mental illness, and an insufficiency of health literacy on the health risks of ADHD. We plan to create an intervention by utilizing face-to-face interviews to establish rapport with our clients to build back a possible loss of trust and to target areas where the community may lack in mental health literacy. We also plan to provide a community center to create a safe space for both clients and staff so that our clients may receive professional services such as evaluations and counseling. We aim to build a team of dedicated specialized professionals whose shared mission is to provide free service care for medically underserved women who may be suffering from late diagnosed or undertreated ADHD. We will work alongside with major organizations such as CHAD and the ADHD Center for Success San Diego to better provide for our clients. We hope to reduce the stigma surrounding ADHD, mental health wellness, and the distress of our healthcare system. We look forward to the improvement of mental health outcomes and the overall well-being of medically underserved middle-aged women. We plan to advocate for continued improvement of healthcare access and support services in San Diego County, and to raise awareness on the overlooked issues of living with undiagnosed or late diagnosed ADHD.